Hello, everyone. Thanks for joining us for this short and fireside chat session with Ken Letkeman. In the current world, we wanted to understand from Ken on how IT and innovation is helping battle COVID-19. Briefly about myself, I'm the Senior Vice President for Healthcare Provider and Healthcare Services Market within Sirius Tech. We help a lot of large health systems in battling and coming over the crisis. Before I turn it over to Ken, briefly about Ken, right? So Ken has been a trusted friend or advisor for a long time, as well as Senior Vice President and Chief Information Officer of Houston Methodist. In this current role, Ken oversees the entire IT and innovation. And what we thought was we'll spend some time learning from Ken how he's best battling and preparing, to battle this pandemic. With that, Ken, great to be part of this discussion, and thanks for taking your time.
Thanks, Abhay. Thanks for having me. It's a pleasure to be here to talk about IT and innovation and how we're using it to battle COVID at Houston Methodist. A little bit about Houston Methodist. I won't talk too much about myself. I'm Chief Information Officer. I work closely with the Chief Innovation Officer, Roberta Schwartz at Houston Methodist. I do, as you mentioned, run the IT organization. And I'll talk a little bit about our health system when we do an introduction. I won't spend too much time on that, and then we'll move on to kind of probably the topic at hand, which is all about how we're addressing and reacting to COVID-19 at Houston Methodist. Houston Methodist, for those of you who are not familiar with us, is a system largely in the Houston metro area and surrounding area. I have a map there that shows our footprint. We are a 7-hospital system. We have 1 LTAC. We have hundreds of clinics in the area, 25,000 employees roughly, and have been largely recognized across the United States. Last year, we were in the top 20, recognized as the top 20 health systems in the United States by U.S. News Report. Last year celebrated its 100th year anniversary in 2019, and it's ironic because 100 years ago, or now 101, Houston Methodist was founded during the Spanish flu epidemic and in response to that. And so here we are 100 years later, or 101 years later, and we're now in this middle of this pandemic across the world. Just to put it into context for those of you who aren't, because COVID has had different timelines in different parts of the country. Ours started in about mid-March, March 15th. And this is a picture from the Houston Chronicle where, one of our techs, this is actually a Houston Methodist tech analyst that was on the front page of the Houston Chronicle, reacting to an expansion demand, because I'll talk about all the things that happen in our health system, and I'll talk about a preparation, and then an IT's role largely in our response. And I like to talk about this, one of my favorite quotes, luck is what happens when preparation meets opportunity, and that's really very much our case. We truly feel blessed and lucky at Houston Methodist that we were in the position that we were in to do the things that we needed to do in a time frame that really was incredibly accelerated. And I'll speak to that a little bit as we move along.
Sure. Thanks, Ken. Yes, please.
So one of the things that, we to be prepared, we had been making investments and along the way, quite a number of years prior. So we started with, our Epic implementation. I like to think that we built a very strong IT organization. Roberta Schwartz and the group that she works with, and we have a large innovation group at Houston Methodist that's outside of IT, have built a strong innovation culture, a culture to do things new and quickly, but still well. They've developed, and we've developed, a Center for Innovation. We have made significant telemedicine kind of base or baseline investments. And we have a strategic commitment from the very top. Dr. Mark Boom is a huge supporter of innovation at Houston Methodist. And we've really benefited from that level of support. and then the support that Roberta and her team of innovation folks have really driven into our culture.
Perfect. Thanks, Ken, for those insights. And with that, let me open up with the first question that we have from folks in the industry, right? So we see a lot of healthcare providers really struggling, right, with this current pandemic. And like you said, Houston Methodist, ranked one of the best America's best hospitals. So how do you see Houston Methodist really combating COVID, right? And then in that sense, how do you safely deliver care for your patients?
COVID-19 in the Houston area began, as I mentioned, around 3:15. We had the Harris County stay-at-home order. Harris County is one of the largest counties in the United States and encompasses a lot of the Houston metro. On 3/24, the governor issued a statewide stay-at-home order around 4/2. That order was eased around 4/16, and our peak was sometime in between there at Houston Methodist. And then reopened kind of towards the end of April. During that period of time, we expanded our highly infectious disease unit, we expanded our ICUs, we expanded our virtual ICUs, and I'll talk more about that. We went from 24 beds in our virtual ICU to 126 beds on a very accelerated and rapid timeline. We implemented virtual rounding, got some graphic or some pictures of that in just a minute. Telemedicine, I'll talk more about that, but telemedicine, our ambulatory practices expanded from 4 to 7 case encounters a day to way over 2,000. Implemented screening, lab changes, new instruments as they came online, as I'm sure a lot of health systems did. And we rapidly employed iPads for patient engagement. I'll talk more about that kind of towards the end of our talk, Abe. In addition to all that, we moved about thousands of administrative and non-care related employees remote working environment like everybody else did, right? And we enabled Microsoft Teams weekend, and we have about 7,000 active users on Microsoft Teams every day.
Perfect. Thanks, Ken. And that brings us to our second question. Really, COVID has had a lot of, these short-term and long-term implications, as you mentioned. When we polled our set of health systems, a very similar, technology surges in terms of patient monitoring, in terms of telehealth, virtual care, and also looking at the alternate revenue streams, right? I mean, you're looking at now telehealth and virtual care becoming a norm. So what do you think will be the new norm, right, as the organizations come out of COVID? What becomes the new normal in your sense?
Yeah, I think the new normal is virtual and mobile, right? And virtual both in an inpatient setting and in an outpatient setting. And the mobility really became a key strategy and technology that allowed our care teams to look after patients safely and our patients to communicate both with their care team and their family, which is something that you really don't think about. When you have a no visitor policy or a one visitor policy, our patients are isolated and they don't have family near them. And so we did some things to address that as well. And I'll talk more about that. Our virtual intensive care, we've expanded. We have a bidirectional audio communication with our VICU. There are privacy indicators for open video and audio. There's a telehealth button to contact the operational center. And as I mentioned, we rapidly expanded that. And we also implemented something called virtual rounding. And I'll talk more about that in just a second. With regards to our virtual ICU, I mean, this was something that we were preparing for, and we really accelerated. And we had camera and monitors installed in all of the 163 ICU rooms at our flagship hospital at Texas Medical Center. And then between March 16th and May 11th, which is really COVID, we responded. We rapidly expanded, as I talked about, and we have responded to 400, virtual alert button calls and 7,000 remote connections to patient rooms. So it's been really, we were in many ways fortunate that we were at the ready, and also fortunate that we were able to expand that. The other thing that we had implemented, and this took quite a while, was we had implemented a system by medical informatics called SickBay to make physiological data available remotely as well. And so that was a solution that we had implemented at Houston Methodist prior to COVID in anticipation of the needs of physiological monitoring remotely, and also serving virtual ICU, which kind of just really worked as a great strategy for us. Here's some pictures. So this was what I talked about, virtual rounding or telerounding. We set up, clinician or physician lounges, and that's the picture on the left. And then we had these iPads using video technology in the rooms, so that consultants and specialists could see patients, could see physiological data like I talked about, and could do everything except for physical exam. Of course, there was a clinician in the room to do that with all the PPE. So this really allowed us to enable rounding throughout the periods, and this is something I think is going to stick around. As far as medicine training and our technology hub, we have a technology hub, as I mentioned. It's part of our Center for Innovation. We used it during COVID to train clinicians. We trained about 300 in 6 weeks. And if you look at the bottom right, this is our project in virtual care. On March 1st, we had 66 providers that were trained. By March 25th, we had expanded that to 900. And so, just unbelievable in our telemedicine practices at Houston Methodist. And here's a graphic, and this one's really, this one's interesting. This is the orange bar is total visits. The green bar is total clinic visits or inpatient in-person visits, forgive me. And the blue bar is virtual visits. And if you look over on the far left, the January and February, see that little blue bar? that's 47, okay? And if you look at about the peak, we peaked nearly 3,000, 2,800 virtual encounters a day. And this technology really kept us in touch with our patients during COVID-19. This is something I expect to continue. At what level? I don't know. Recently we've seen an uptick in-person visits in our clinics, but we've seen a slight decrease in a number of virtual visits, but still in the thousands, nowhere near 47. This graphic shows the virtual care visits through May. We count all the different types of encounters and all the different types of visits. MyChart visits, VidYO calls, those are those ones that telerounding call, telephone consults, My Methodist virtual urgent care, and I have some graphics or a slide on My Methodist, and then e-visits, to a total over 100,000 encounters that were enabled using virtual technology. And technologies from Epic and VidYO, and as I mentioned, physiological data through medical informatics. This is this slide shows the virtual urgent care completed visit volume, and that's again kind of demonstrates how abrupt the volume change was. And we were very, very fortunate that we had built systems and we had systems in place that were able to scale. And these graphics really do demonstrate that we were able to scale.
Thanks, Ken. And this is really amazing that the volume and the ramp ups in such a short time, right? Especially if you look at the number of physicians that you had to ramp up and the number of virtual visits. Shifting focus on the technology side, right? So while telehealth and virtual care is here to stay, do you see, with this current pandemic, giving an opportunity to areas, on the newer side, right? So newer technologies, be it on automation, data science, and a more increased focus on analytics, right? But do you see any of these getting more momentum in any ways within your Health First Time and others?
I do, and I actually brought a couple of examples. Yes, the short answer is absolutely, right. The need for data has never been greater. The need to understand that data has never been greater, and we are using RPA. We had actually invested in RPA prior to COVID. One of the use cases I brought, for the presentation today is around using our WorkFusion RPA platform to automate. We used it to as part of the automation of claims that we were now making as part of COVID in our COVID response. And during the period of time, we had 2 days after we had implemented the RPA. we submitted 634 claims in 2 days, which amounted to about $12 million in charges, and we're expecting, a certain amount of reimbursement on those charges. We used RPA and intelligent automation to basically enable workflow. Another place where we used artificial intelligence during COVID was with something called Syllable. It's a phone bot, and we're constantly looking as part of our innovation work at Houston Methodist to leverage AI and automation to eliminate repeated tasks. And the IT teams partnered with this company called Syllable and launched a couple of AI-powered phone bots. And what they did was they gave COVID information in a couple of languages, English and Spanish. They sent text messages, if they detected that the person calling wanted, to get to virtual urgent care, they would send a link to get there. Or they wanted to get to the COVID website. And finally, they directed patients to CDC. And we had a lot of volume of calls that went through these bots. And these bots were actually implemented during the COVID crisis. So this is stuff that we brought online while we were fighting the fight against COVID-19.
That is great, Ken, and those examples really showcase how the newer technologies can be used, right? And especially as they are already part of your technology stack, it becomes easier for you to roll it out during a crisis like this. Coming over to patient and patient experience, right? So there was a recent survey done, right? And almost 2/3 of the respondents, they have willing now to try telehealth in the future, right? And I think your charts really shows that. So how do you see patient experience overall, right, in this post-COVID world, right? I mean, what would be different? Do you see patients' experience really taking a very different turn post this? And what has been your and Houston Methodist experience in that?
Yeah, I think that the patient expectations and experience is going to change and has had to change, right? And I'll talk to some of the things that we're doing. One of the things that we found with our patients is when they're in our facility, they're used to being connected. And some of the things that we immediately implemented were when we changed our guest and visitor policies, as I talked about with COVID-19, we had to find innovative ways to connect our patients and our families and their families, forgive me. So we implemented these things called guest iPads. This was actually a COVID thing. About our longer term strategy in just a little bit, but in the short run, we implemented these guest iPads. We gave them to our patients, of course, infection control, managed how they were cleaned, and we gave them connectivity to the different types of technologies like Zoom and WebEx and Skype, so they could actually, engage with their families. We allowed them entertainment access for all the different YouTube and Prime and HBO and all the movies that you want to watch and content that you're interested in. And then we allowed them we gave them information from CDC, on Houston Public Health, and from different sources. Our patients, we got so many amazing comments and great feedback from our patients that we recognize that this is something that is there to stay, right? Enabling them to communicate with their family during their stay, during a time of very high stress for them, right? And concern really helped our patients kind of navigate their care and their experience at Houston Methodist. Another thing we've done is we've implemented Amazon Alexa and technologies on top of Alexa called Ava. We're working on trying to enable and engage our patients and bring technologies that they're familiar with, right, in their home into our inpatient settings. Example of current use cases we're working on are, Alexa call number, right? Alexa, tell me, the things you do at home. And I have to be careful. We've deployed 350 Alexa devices to our cohorted COVID-19, and we really see this voice enablement in the room, both for patients and care teams, is something that, first of all, our patients are used to and really want. And secondly, that's really going to give them connectivity and an experience that I think they're something that they're really they clearly have invested and engaged in at home and are anxious to do it in an inpatient setting. Future use cases for us. I want to order food, I'm in pain, call my nurse. These are all the things that we see that could add a lot of value both to the nursing units and to the care teams, but also to the patients. Another thing we did during COVID, and we had prepared and expanded our app. So we have a My Methodist application. It's been very popular, a lot of downloads. I think our numbers now are over 135,000 downloads and 30,000 in the last 60 days. We added onboarding screening for COVID patients. We added symptom checkers for COVID patients that used a bot to help them assess their symptoms and appropriate care. We added a Find a Doc visit flag that for all of the physicians that were offering and accepting video visits, and made that easy for them. And our patients really responded. I mean, we've had a tremendous amount of success with our application. It also supports MyChart integration. And so this is a technology, obviously mobile technologies are very much here to stay, but consumer facing, mobile technologies are also very much in demand. Finally, we are looking at something we're calling a patient empowerment tablet. And this is an expansion of the guest iPad, and we're really excited about this. We're looking at integrating these tablets or iPads in all of our patient rooms, giving patients access to MyChart, to nutrition order, to entertainment, as we talked about earlier, to some environmental controls, because some of our buildings don't support temperature, but in the future they may, but also things like lighting and fans, educational information, and to other tools that they may need during their stay. We see this as, again, based upon the feedback that we got from our guest iPad experiences, we're now going and investing heavily in making these services available across the health system at all of our hospitals and in as many beds as we can. Clearly, some beds don't make sense, but most of them will. And just a final note, at Houston Methodist, we always try to keep the patients at the center of everything we do. Our ICU nurses have been caring for COVID-19 patients throughout the encounter, as all ICU nurses have across the United States and large end of the world. Our technologists have been supporting those care teams throughout the experience, throughout the event, really, and at the front lines. And we're very, very happy and proud with the work that's happened within IT and innovation to support the COVID efforts, the critical COVID efforts of our care teams at the front line.
Thanks, Ken, for your time. I mean, these are great insights, and I am truly hoping that everyone listening to this would really help from this. Any closing comments, Ken, before we sign off? And again, thanks for your time. We look forward to your partnership.
No, thank you, Abe. This has been awesome, and it's been a pleasure to be here today. I'm happy to talk about the things that have happened over the last 60 to 75 days, which is really a short period of time. I'm sure that others have had similar experiences where they've been able to do things in a very rapid fashion that would have taken months and maybe even years. And we feel very fortunate that at Houston Methodist we were able to really take advantage of the building blocks. And thank you very, very much for allowing me some time today and to talk about the things we've done, and hopefully this helped some of the folks that are watching and listening today.
Sure. Thanks, Ken, and stay safe.
All right, you too.